Ulcerative colitis is a chronic inflammatory condition of the colon or the large intestine, which we encounter more and more frequently in our practice these days. So what is ulcerative colitis? What causes this problem? What are the symptoms? How do we diagnose this? And what are the treatment options available for this condition? Ulcerative colitis is a disease which is multifactorial in origin. There is no single reason why somebody develops ulcerative colitis. It is an inflammatory condition of the colon because of certain genetic makeup of the patient, because of certain other environmental factors. The colon continues to remain inflamed. It can cause ulcers, it can cause bleeding, it can cause oozing. So what are the symptoms of this condition? Patients with ulcerative colitis generally present to us with repeated attacks of diarrhea. Initially they think this is because of some infection, they take some antibiotic, but this diarrhea refuses to subside. They keep on getting repeated attacks of diarrhea wherein they might pass even 15 to 20 motions per day, and many times this diarrhea may not have motion, it might only have mucus and blood in it, and that is when one starts suspecting ulcerative colitis. This diarrhea can be very severe that the patient may lose sleep because he has to go to the toilet for 5 to 10 times in the night. Because of excessive and continuous blood loss in the motion, the patient can get anemic. In very extreme cases, ulcerative colitis also can lead to development of cancer in the large intestine. How do we diagnose ulcerative colitis? One of the most simplest ways to diagnose ulcerative colitis is by a colonoscopy, wherein an endoscope is passed through the anus into the colon and multiple biopsies are taken from the colon. And a study of these bits of colonic mucosa usually confirms the diagnosis of ulcerative colitis. How do we treat ulcerative colitis? A large number of patients with ulcerative colitis respond very well to medical treatment. The medicines are either given in the form of tablets, or in some cases they are given in the form of enemas, which is a liquid medicine which is given through the anus. Patients who do not respond to these medicines or who continue to have severe disease, whenever patients who do not respond to these medicines, or patients who become dependent on these medicines, meaning when they take the medicine they are alright, but when they stop the medicine the disease comes back, or patients who have very severe disease at the presentation, or patients who have developed cancer because of ulcerative colitis. These are the groups of patients where one has to do a surgical treatment. What is the surgical option for ulcerative colitis? The surgery of choice is called a total proctocolectomy, which means the colon is the organ which is affected in this disease. So the surgery entails removal of the entire large intestine. So once the entire large intestine is removed, the patient cannot pass motion normally. To recreate an artificial passage for the passage of motion, what is done is the small intestine is refashioned into a reservoir whereby it takes over the function of the large intestine, and that is attached to the anus. And this operation is called total proctocolectomy with ileal pouch creation. And this operation is a very effective operation for ulcerative colitis because it removes the entire colon, and thereby the disease cannot come back again because there is no colon. There are many advanced latest monoclonal antibody therapies which are available for ulcerative colitis, which has decreased the need for surgery in many patients. And these medicines, even though they are costly, they are very effective in the cure of ulcerative colitis.